Malaria is a potentially fatal blood illness spread by mosquitoes. Humans contract the Plasmodium parasite from the anopheles mosquito. These parasites are the source of the fever, chills, and headaches associated with malaria. Early detection of malaria in some areas can aid in its treatment and management. However, many nations lack the funding necessary to conduct efficient screening. Around 241 million trusted source instances and 627,000 disease-related fatalities were reported worldwide in 2020. Although there are only 2,000 cases of malaria annually in the United States, most of them are among travelers returning from countries where it is still prevalent. The authors of a 2021 study, however, warn that climate change may lead the number of instances to increase once more in the nation. Symptoms: fever, chills, and headaches are classic symptoms of the illness malaria. It can develop into serious or even fatal consequences. It can have a wide range of effects on individuals. Some people only experience minor symptoms, while others may experience serious illness. Malaria symptoms are split into two groups by doctors. Uncomplicated or severe malaria, reliable source. Flu-like symptoms may appear, usually last 6 to 10 hours, and return every other day. Trusted source. Some parasite strains, however, have the potential to have a longer cycle or produce a variety of symptoms. General signs include: A. Chills and fever. B. Sweating. C. Headaches. D. Nausea and diarrhea. E. Muscle aches. F. Weakness. G. A swollen liver. H. Slight jaundice, which can give eyes a yellow appearance. I. A faster pace of breathing. J. A widespread sense of malaise. In regions where malaria is rare, a doctor might provide the flu as the diagnosis instead of malaria. A person should talk to their doctor about their recent visit if they experience these symptoms after having recently traveled to a region where the disease is prevalent. Flu cycle. The typical malarial fever cycle lasts 6 to 10 hours and repeats every other day. It entails: A. Shivering and chills. B. In young children, fever, headaches, vomiting, and potentially convulsions. C. A perspiration stage. D. A rise in temperature that coincides with weariness. The Centers for Disease Control and Prevention, CDC, point out that this is an uncommon occurrence. Attacks may happen every third day with some Plasmodium strains. Acute malaria. Malaria occasionally progresses and impacts important bodily organs. At this phase, more than 5% of the red blood cells are infected with malaria parasites. These signs include: A. Serious anemia. C. Urine with blood in it. C. Modifications to blood clotting. D. Diminished awareness. E. Alterations in behavior. F. Significant levels of acidity in the body's fluids and blood. G. Seizures. H. Coma. I. Severe malaria is a medical emergency that poses a risk to life. Complications. Possible malarial side effects include: A. Liver disease, which may cause jaundice. B. Renal failure. C. Abnormally low blood sugar levels. D. Spleen enlargement and rupture. E. Shock, characterized by a sudden drop in blood pressure. F. Pulmonary edema, in which fluid accumulates around the lungs. G. The breathing-related acute respiratory distress syndrome. H. Dehydration. I. Relapses of malaria. Malaria caused by some Plasmodium species can go away and come back months or years later. This happens as a result of the parasite's latent periods, during which no disease activity occurs. However, if they reawaken, symptoms may appear. A person should seek treatment after their first episode since it can assist them avoid relapsing. Treatment. The majority of malaria patients will recover completely with prompt treatment. People with the condition receive treatment that includes: A. Treatment using medication to get the parasite out of the blood. B. Complementary care. C. Admission to the hospital for those with serious symptoms. D. Intensive care, occasionally. Main antimalarial medications include: A. Chloroquine. B. Hydroxychloroquine. C. Primaquine. D. Treatment utilizing artemisinin. E. Atovaquone Preguano. Typically, the therapy session lasts 2 days. The length of the course of treatment and the type of drug, however, may differ according on A. The Plasmodium species that caused malaria. B. The severity of the symptoms. C. The location of the malarial infection. D. If they have ever taken antimalarial medication. E. If the individual is expecting. People who experience difficulties may also require a mix of drugs. Prevention. Malaria prevention measures include A. Awareness of the risk. B. Avoiding mosquito bites, for instance, by wearing arm and leg coverings and using insect repellent. C. Using antimalarial medication when visiting a region where malaria is a problem. D. Receiving timely medical attention and diagnosis if someone suspects they may have the condition. E. Giving the vaccination to children who reside in areas with an endemic malaria epidemic. The effectiveness of antimalarial medications in preventing malaria is about 90%. Even if a person uses these medications, they should still take precautions to avoid mosquito bites when visiting an area where the disease is likely to occur. Anyone who intends to visit a region where malaria is prevalent should ask about antimalarial medications well in advance of their trip. Most of the time, folks must begin taking the medications several additional days in advance of their trip. Before consuming some drugs, they could also be required to take tests, and setting up these screenings can take some time.